A very good afternoon, ladies and gentlemen. A very warm welcome to the Deep Tech Summit 2020, presented by SGInnovate at Singapore FinTech Festival and Switch, and to our panel discussion on the future of healthcare innovating for the new normal. My name is Joy. I'm the CEO of SGInnovate, and I'm moderating today's discussion. And I'm very privileged to have with me today Shobana Kamineni, who's the Executive Vice Chairperson of Apollo Hospitals Enterprise, Mr. Abel, who's the Group CEO of Advanced MedTech, and Professor Robert Morris, who's the Chief Technology Strategist at the Ministry of Health Office for Healthcare Transformation. Professor Morris is also a professor at the National University of Singapore's Yong Loo Lin School of Medicine, as well as a non-executive director at SGInnovate. So very warm welcome to our panelists. In line with this year's Deep Tech, with the theme of this year's Deep Tech Summit, we will be discussing how healthcare providers, corporations, and governments are innovating to better meet our healthcare needs in the so-called new normal. Driven by the exigencies of the pandemic, one of the most striking, and I must say uplifting developments has been the surge in innovation, notable for its breadth and depth, and the coming together of the scientific intelligentsia from all over the world, in spite of the politics, in an effort to beat the virus. The innovations take many forms, from software to hardware, and what I call wetware, by which I mean diagnostics and drugs that were developed out of a wet lab, so to speak. In Singapore, there has been very rapid development of contact tracing platforms. Robert's office has been responsible for a number of rapid innovations, from symptom checking platforms to vital signs monitoring telesystems, to the iConnect COVID platform, which manages swab tests. In India, Apollo Hospitals has changed how a country of 1.4 billion people approach healthcare, building a healthcare ecosystem that comprises more than 7,000 physicians and 30,000 allied healthcare professionals. Within 6 months after launch, the Apollo 24/7 digital health platform had enrolled 4 million people at a rate of around 30,000 downloads a day. Outside of the digital space, Abel's company, Advanced MedTech, had developed the RAVE automatic lab system, which is used by Parkway Pantai. And the RAVE system improves the efficacy of managing the process of diagnostic testing. So I'm going to start by inviting our panelists to introduce yourselves and to share briefly with the audience if you look back to the early days of the pandemic, what were the initial challenges that confronted your organization, and how did you manage that? So why don't we start with Shobana, followed by Robert, and then I have a separate set of questions for Abel. Shobana?
Welcome to everybody during these really, I think this is the most testing time that my father, the founder of Apollo Hospitals, is 87, and he said he's never seen such a challenging time in healthcare. So I would think that, the COVID-19 pandemic has placed unparalleled demands on modern healthcare. The industry's response, however, has vividly demonstrated resilience and the ability to bring innovations to market quickly. So if you ask me what was the big thing that we look back on 8-9 months from the time that it really hit us, what we saw is that our ability to keep changing, that we needed to be very agile at this time. We created this red book of protocol in the hospital of how to treat patients that come in. And what we've seen is that we're in our 23rd iteration, because all our doctors would get together and say, well, this is working, this is not, here's the experience. So the collaboration has been huge. So when you look at innovation, I think it's the fact that we've all been, that we have one common cause to sit and collaborate. So agile, collaborate, and actually start, using those resources that that might not, you would not have thought of it for a virus. Like some of the medication we're using today is, in the early days, of course, the chloroquine, but more than that, I think that what the other medicines, the medication we're using was used, one was used for a dermatological use, the other one was for cancer. And you put all these together and you're testing and trying to figure out what is actually working, what's the right protocol. Now, what we've realized is that it's not about preventing, that's always the big one. It's about treating, but it's also about what's happening post-COVID, because the kind of complications we're seeing is a whole host of, which could bring down the medical infrastructure for the next time. And then, of course, the vaccine, I think, is the real hero story of the medical pandemic, because CEPI had a target of saying 16 weeks since we sequenced the genome, we will try and find what the candidate is for a vaccine. They did it in 10 weeks. And we're involved with some of the phase 3 studies in our hospitals. And what we're seeing is just that the ability of countries to collaborate, of medical teams to collaborate, of supply chains to collaborate. So I think that whatever the pandemic leaves us with, it'll leave us with great lessons that we've learned in collaboration, in agility, and at the end of it, resilience.
Robert,
yes.
you can start with a quick introduction on MOHT, which is a dual outfit within the Ministry of Health.
Yeah. So we're recently formed, the Ministry of Health Transformation, and our goal is to transform. And not too long after starting, we got the experience of working on COVID. And COVID is obviously a massive coordination task. We have pretty much every agency, ministry, academic institution, private sector, all involved and pulling together. And we had the benefit, I think, of very good organization, from a ministerial task force to a coronavirus task force, several technical task forces. And maybe I'll just give you a technical example of something that was done very quickly. In the first few months of COVID, we were very worried about appropriate use of healthcare services. We were very worried about our ICUs, our hospitals being flooded, our clinics being flooded, them becoming centers for infection, etc. And one of the healthcare systems brought to us a request to quickly build a symptom checker, because there wasn't much known about what symptoms the individuals, patients, public should be paying attention to. So we were able to quickly pull together a set of infectious disease and primary care and hospital experts, quickly put the requirements together. And within a week, we had a working web app, which we were testing. We got it approved by our coronavirus task force, and we had it out and running and in the hands of users a week after that. Now, something like this, obviously, as we got more knowledge about the disease, we kept changing the criteria, the thresholds, etc., that we had to use. And we also had to translate it in. We had a total of 6 languages that we had to put it into, because we had very diverse users, and we kept revising it. But to this day, it's received over 1 million uses, which I suppose is not large by India standards, but it's pretty large for Singapore.
So we did the same, what you said, but with 12 million.
Yeah. But many of our users, we've surveyed many of the users. And of course, what it helps them to do is not go to the hospital if they shouldn't be going to the hospital. If they go to a clinic, they can go to one nearby. They can go to one which makes sure it has a test available. So all of that was put in place. And the surveys show that the users are following it. So something like that can be done quickly. And there's a real learning in that, because things that you would normally think of taking months and months to get approved and to build and deploy resources for, if you really have to do them, you can do them in days and weeks. And if you use the right techniques, if you use public cloud, of course, you cannot sacrifice on privacy and security. But if you really work at it and everyone's pulling together and you get approvals quickly, those things can be launched in a matter of weeks. So we took that as very encouraging, and we feel that's had a good benefit for us.
Thank you, Robert. Abel, want to give a quick introduction to advanced MedTech and some of the challenges you faced in the early days?
Sure. Thanks a lot, Jeev. Thanks to SGInnovate and the organizers for the invitation. I like to say that advanced MedTech is a $200+ million US medical device startup. We have about 1,000 people around the world, and our headquarters is actually proudly here in Singapore. Maybe quickly about some of our challenges that we face. I think the most significant challenge that we face is what I call a concept of a strategy or strategic blindness, right? I think that here we are in 2020, which is year 6 of our 10-year strategy plan. And we've been executing the strategy for the last 6 years to great success. And I think that when COVID hit, kind of in Chinese New Year, January timeframe, we were very focused on executing our strategy, right? And I can tell you there is no COVID-19 in our strategy. So for us, strategy doesn't just tell us what to do, it tells us what not to do. So for the better part of about 6, 8, maybe 10 weeks after the pandemic hit, we were still pretty much hunkering down executing the strategy. But I received an email from the CEO of Temasek Dilan, and he kind of inspired me to really take a look at what we should do in the crisis. And that was the inspiration that led to us starting what we call the Million Mask Project. It's a project that we actually started to donate and distribute masks around the world. And now we are at about 3.2 million masks distributed and donated around the world, of which the donations went as far afield as Brazil. We did a lot of donations in the US, in Germany, in Russia, all over the world, really, even in Japan. At a point where there were really no masks anywhere in the world, right? And we were able to do that. And that Million Mask Project eventually rolled into what we call the Billion Breath Project, which is our ventilator project. We have developed a ventilator with our partners, ABM Respiratory, here in Singapore, and we are manufacturing it in our facilities here. And that also led to us getting into the COVID kit testing business, which is the Resolute 2 product, together with A-Star and the outstanding people there, together with the Rave automation solution. So we've kind of moved from a company that had no COVID projects, strategically blind, so to speak, to a company now that we've generated very significant revenues and sales from our COVID-related businesses in partnership with many people, right? And I fully agree with what Robert said. I think that having a common enemy and having tends to focus the mind. And that has led us to really accelerate a lot of our innovation, but also pivot away from what we've been doing for the last 6 years into many different areas, but using essentially the same skill sets, right? Moving like a startup, innovating quickly, engaging with the regulatory authorities, working with partners. I think these are all some of the skills that we had honed in other areas that were applicable in the area of COVID-related and innovation.
So I'm just going to, ride on this momentum with some of the things that Abel has talked about, and I'll come back to some of the questions around digital transformation a little bit later. But when you talk about pivot, how painful was that of a decision to make? I mean, it was probably mitigated by the fact that there was a common enemy, like Robert says, and there was great pain all around, gnashing of teeth. But certainly, it must have come at the expense of something else. Have the other business units been hurt by this? And how did you make a decision on a million? I think perhaps 1 million masks might have been easy. What wasn't such a big commitment, but certainly 1 billion breaths starts to get expensive, and certainly going into diagnostics and automated test handling system must have been incredibly expensive. So, walk us through how you thought about those issues, please, Abel. Thanks.
Sure. I think that you're right? I think that I like to joke with my team that I think that the first couple of months that we were running after the billion breath, the ventilator project as an example, and just as a case in point, during the course of a lifetime, a person will probably do 20 million breaths, right? So that's why a billion breaths is not really difficult to get to if you think about what a ventilator will give back to a person in terms of breathing. But I like to joke with my team that for the first few months when we were chasing these COVID projects and we had nothing to show except lots of expenses, it was a time of great stress and risk, right? And I give full credit to my board. They backed us. They felt that this was something that we had to do. Our board, as Dri knows, is led by a gentleman called Mr. Philip Yeo, who is known as a maverick in and of himself. He's a force of nature. And he backed and supported a lot of the things that we started to do with, at that time, really no certainty that we would succeed, right? As you can see, there were many ventilator projects that fell by the wayside and died along the way. And here we have a ventilator project that is actually the first one in the world, a ventilator that's the first one in the world that you can do telehealth ventilation. It's a full bi-directional control to the extent that we can have 1,000 ventilators managed by 2 people in a ventilator operations center, no different from a network operations center that you would see with Amazon or Microsoft and so on and so forth. So I think these were difficult times, but the great thing is that we had a common enemy, and that created a lot of air cover. The other thing that was very interesting and certainly was out of our comfort zone is we used to own a diagnostics company in Singapore, which we divested about 2 years ago. And we came back into the diagnostics business again recently. And within 6 weeks after the first meeting, we had built a manufacturing facility that could make 3 million diagnostic kits a month, right? It was surprisingly easy to do from a decision-making standpoint, because there was so much of a need, not just in Singapore, but in the region at that time. But again, in this respect, we were given a lot of air cover and a lot of support by our board to go and chase these things and make these things happen. So, pivot requires not just a bunch of crazy people prepared to put their heads on the line, but also support from the stakeholders as well as the board members.
Yeah, I mean, that's really admirable, because this was a very important, huge pivot. You could understand even with the ventilators, there was some coherence with your prior expertise in medical engineering, but moving on to diagnostics would have called for a totally different kind of expertise, and to be able to do that in such a short order and do that successfully, it's a real credit to Advanced MedTech and your leadership.
Actually, I think maybe it would be remiss of me to say this. I think the credit doesn't belong to us. It really belongs to the partners that we worked with. I think that we really had outstanding partners. People like A-Star were fantastic partners. HSA, the speed that they provided approvals and the level of engagement and contact. I mean, I have the head of the medical devices branch's handphone number on my cell phone, right? And she basically was, if you need anything, just call me. I mean, look, prior to COVID, I can tell you I did not have her phone number, right? But that's somehow having a common enemy and being able to pull everybody together and chase a common goal. I think the partnerships were important. Folks in MOH were wonderful, EDB. I can't even name all the people that we worked with, but fantastic partners, incredible partners. I think credit really goes to them.
Thank you. And Shobana, just for your benefit, HSA is the Health Sciences Authority. That's the body that approves new devices and drugs.
Oh.
Let me come back to digital transformation now. Digitalization of healthcare systems, digital health transformation, these are now buzzwords anytime the topic of the future of healthcare is raised. So again, let's start with Shobana. Just questions. I mean, all this transformation, what exactly do we want to see as the end state of such transformation? And following that, what are some of the cornerstone battles that need to be fought and won? What are some of the challenges that need to be overcome in order for the other dominoes to fall to make transformation possible?
I need to make that very long answer super concise, but because there's so many things to be dealt with. And if you really look at it, digital transformation to me, very simply would mean that that the ultimate consumer is able to understand health better, to be able to access it 24/7. So geography, it's not about geography, it's not about time. And then they should be able to have access to accurate care that can actually have measured outcomes. So today so if you have a health insurance policy, it should be measured by how much we can keep you well. So whenever it comes down actually to a transaction, it should be something that is measurable with an outcome that benefits the patient in the most easy way. Now, having said that, now this is from a patient perspective, from a doctor, and they want to see how much they can stay out of a hospital with that, how long they can stay well, how long you can lock the disease. If you have diabetes, let me not progress to the next stage. Let me not progress to the next stage of cancer, or let me catch it early. All these, from a hospital point of view, we would look at what is it that we can do to make sure that that we can bring down costs, stop wastage. All this can be done with so much more digital transformation. And I think the best thing would be, how can we make diagnosis more accurate? And if you look at the role of robotics, I once asked someone, I said, why do we need this robot when we have fantastic surgeons? They said, if you're a fantastic ambidextrous surgeon, you don't need this robot. But what we're doing is that we're making a beginner into an expert. And that's what this digital transformation at all levels should do within a healthcare system. How do I make a nurse my expert? How do I make everyone in the system an expert? How do I collate this? And how do I disseminate it? How do I save it in a way that can actually bring better outcomes? So this is the entire gamut of digital transformation that we've been going through. So what are the cornerstones for those dominoes that need to fall? One is something that Abel kind of referred, or what you talked about, it's your health authority. So once you have those on board, because so many of the decision making is in the government's hand, so they can make it as light as possible, they can make it as fast as possible. Fortunately for us, COVID has brought this digital health mission. So they're trying to give everybody, like a social security number, a health number that can be, for portability, whether it's your insurance, whether it's your medical records. And I think this is really important, to create that health stack. The new healthcare systems of the world will have an interoperable, portable health stack. And to do this, the next thing we would need is faster digital networks. And I think when 5G comes, there will be a huge transformation in the way that healthcare will benefit from it. I could think that we would not only do robotic surgeries within a hospital environment, but we could do it almost 1,000 kilometers away if you have 5G, if you can, the latency. So I think that these are the big ones that will create digital transformation. Another very important one has to do with trust and security. If you breach that even once, it's very difficult for a patient to be able to say, I'm going to trust you with my records. if there's a data or a cybersecurity breach, because that can be used and abused. And the last one, because you said 4, I would say is that we need to have guardrails in place of how much you want and how much can you do. I very much believe that if there's a way that a CRISPR technology can take away diabetes or NCDs before the baby is born, that's great, to have a world without NCDs. As much as I believe in prevention, but if you take it to another level, there should be guardrails that protect medical science very carefully. And I'll stop there.
Let me come back to the question of guardrails. But let me just turn to Robert now. Robert,
Well,
what are your views on
yes,
the state of transportation?
Shobana has described that very well from a clinical perspective and some of the prerequisites such as privacy and security, etc. Maybe I'll take a slightly different lens on that. One of my favorite quotes in healthcare is from the WHO. It says that health is the state of complete physical, mental, and social wellness, not merely the absence of disease or infirmity. And what does that mean to us as like a final end state? It means that we have to integrate. It means that we have to integrate services, we have to integrate data, we have to pay attention to mental health, which is a very neglected part of our portfolio in Asia. We've been spending a lot of time on that. And also, we need to realize, as is well known and well documented through meta-analysis, that at least 60% of healthcare outcomes follow from the lifestyle and the lifestyle choices, social and environmental factors. And so what that says is this data, all this data that we now have available in islands, like data on socioeconomic conditions, social determinants of health, and even the data that I have on actually I'm not wearing a wrist wearable, I'm wearing a ring device, which collects all that data for me. That data is very determinative. I can make a lot of predictions about my health outcomes based on what's being captured on that. How do I pull that together? And then once we pull that data together, a couple of other things we have to do. We actually have to pull the services and the interventions together. So those interventions, as people age, and even in India, the birth rate's going down and lifetimes are becoming longer. The care model and the burden on labor-based services is going to become enormous and unaffordable. So we have to think about self-help. We have to think about self-empowerment. And we also have to think about coaching and nudging, which we'll get from our smartphone or other device. We have to close the loop at the edge to provide us with extra help on managing our stress, managing our diet, managing our activity, etc. So we have to close the loop with technology to displace some of the labor-based services. And then above all, we have to integrate all these services. Like, for example, we're doing a lot on mental health, but we fully recognize that a lot of mental stresses are actually caused by societal stresses. They're caused by things like financial, particularly during the pandemic, financial insecurity, job loss, even increases in domestic violence, caregiver stress, etc. So how do we pull all that together? And when we discharge a patient from hospital, how do we discharge them from social care? How do we get continuity there? So it's all about integration of data, integration of services, reduction and replacement of human services by automated services as much as we can. And with this, I think we'll be able to get this very holistic kind of health outcomes that the WHO advocated.
Very nice.
Yeah. But surely digitalization alone is insufficient. It's necessary but insufficient sort of condition for this integration. What else needs to happen side by side with this digital transformation in your view, Robert?
So I'll just give you one example in our mental health solution that we launched actually during COVID. It's called mindline.sg. What that does is it helps you to do a self-assessment so you can assess yourself instead of having to go, do I need to go to a medical health professional, a psychologist or whatever, or am I doing okay? And in fact, it uses clinically validated tools. I can completely do a self-assessment, and then it could refer me to some self-help tools, some of which are very good now. I mean, things like mindfulness and breathing and stress reduction techniques and those kinds of things are very powerful. They've actually been proven to work. I can get those if that's what I need, but again, I mustn't forget. If my stresses are caused by underlying financial stress, I need social services programs. I need something different. And if it turns out in my self-assessment that I'm in a state of crisis where I could be subject to self-harm, for example, I need to speak to somebody. We can't do all of that with a digital solution. So I need to have those call centers available, those emergency services available. And the whole challenge and the end state is that we do the right thing at the right time. We do it in an affordable way. We make use of technology where technology is appropriate, and we don't try to force the use of technology where we actually need a human caring touch.
Thank you. And Abel, in your view, what is the role of traditional medical devices, what I call hardware, in digital health transformation? Are you in advanced MedTech? I mean, you develop a new device now. Are you already thinking ahead about how it integrates into the hospital EMR, or where do you see what are the crucial interfaces that need to happen for medical devices to be fully integrated into digital health infrastructure?
Yeah, I think that's a great question, Jui. I think that it's McKinsey that said that we've done probably 10 years of digitization in less than 10 months, right? And I believe it because I see it in our own company, Advanced MedTech. I think that we, as you can imagine, we are a medical device company. A lot of our devices are actually sold in ambulatory surgery. And guess what? During a lockdown, ambulatory surgery gets thrown out the window because the ICUs and all the operating theaters and all the environments are full of COVID patients. But because we pivoted and essentially digitization became the mantra across the whole company, we had digital selling, we had digital webinars, we had a digital academy because people needed to be trained, customers needed to be trained so that they could go ahead and do the procedures. We had our applications people actually doing all sorts of training by WeChat, FaceTime, you name it, every platform, right? So this point about integration was really key. And as a result of that, unlike perhaps some of our competitors, as a global medical device company, you can see year to date, we are actually up double digit over our prior year sales. And we are not a small medical device company. I shared earlier that we are in excess of $200 million US, right? So I think that that's one thing, really embracing digital and bringing it to a point where you can actually be in direct contact with the customer and meet the customer need, whatever the customer need may be. And this goes back to the point around televentilation. In my mind, actually, every device that we will make in the future will be connected to the cloud. We already make urology equipment, which as you are doing your therapy, all of the data gets put up into the cloud to the extent that within the first 5 minutes of the procedure, I can already predict what the efficacy outcome of that procedure will be at minute 45. Right? After 5 minutes, just by looking at the data points of what the physician has done. I love what Shobana said just now. Our devices are not necessarily for the most skilled surgeons. Our devices should make the unskilled surgeons as good as the skilled surgeons, right? And that's what we are able to do today. We launched a product several years ago, much ahead of its time, called Smart Lithotripsy, Smart Litho for short. And that's basically a device where within the first 5 minutes, I can already tell you how that procedure will end, right? To 95% confidence. And these are some of the things that as we have moved into a realm where everything is moving digital, that has become in greater and greater demand, right? So that's the first thing. I think the second thing is this, the pandemic and digital transformation also gives us an opportunity to take on additional areas that we can bring digitization into it. So just in the last 3 months alone, we have invested more than 100 million Sing dollars in buying and acquiring companies that we can take our digitization, our tools, our platforms, and our mindset to, in order to bring them into the digital world as well, right? And I think that is an opportunity because, as I think we all would agree, there's huge opportunity to bring the world of digital into the world of healthcare, where the two collide, good things will happen. That's what I think.
So Shobana, what are some of the bad things about digitalization? We keep talking about what, all the good that might come out of it. What's evil? What are some of the things that may go wrong that can, really, really hurt us?
So as much as you can think about the good it can do, just think about what fake news will put out there. And I think that these are the kinds of things that we have to create those guardrails for. And why, like we get patients that come in, and it's great that they're coming in more knowledgeable, but sometimes they take it to another edge and think that the doctor is not necessary anymore. And I think that this is something that we have to that we have to protect for their own good. That the interpretation of what comes out is still not that perfect, and you do need a trained professional at the end of the day. And I think that would be one of the biggest problems that I would see from this, when of too much information being available. And also it's not really tailored to that particular person. I mean, IBM Watson tried it and they put it together, but the interpretation always was most successful when there was a medical team behind it, interpreting it, putting it into context, and actually using it for to be able to get better outcomes. So I think to me this was this would be the one big problem that we would have, that we need to protect ourselves against. And then again, you can think of anything that science can do. So you want to prevent yourself, you want to be able to say that humanity is important, and you want that there are some checks and balances that are required. But then again, it has to be around the world. So like you have nuclear proliferation, I would think that countries need to come together at this point, and the more advanced countries need to be able to have dialogues that will set guardrails for the future. Because once you unleash, once you take it out, there's so much more that can be done, which is not for the good of humanity.
Robert, in your time at the Ministry of Health Office of Transformation, what's the biggest bugbear as far as the clinicians and the healthcare workers are concerned in efforts to roll out transformation campaigns, whether digital or otherwise? Well, let's talk about digital.
Yeah. So I think we've seen quite a lot of those challenges in COVID has been very interesting in the way it's exposed some of those things. I think one of the generic risks with digitalization is that we have to take incredible care with privacy and security, but at the same time we can become so scared of our shadow that we can fail to deploy cost-effective systems. And I'll give you examples for that. Like, for example, we know that genomic information has to be treated extremely carefully, because if my whole genome was to leak out, even if I was to author, I shouldn't even be able to authorize it, because it not only may condemn me, it may condemn my children, my grandchildren, my second cousins to uninsurability or unmarriageability or something, right? However, if we're so paranoid that we regulate it so far that we can't use the data, and we verge on that in some countries around the world, then we are hurting ourselves. So we have to work very hard on technical so that we can use it. Another example is public cloud. Correctly used, public cloud can be as secure or more secure than anything you can do on premises. They put so many rings of security. And also if a bug, for example, is found somewhere around the world, it flashes around the world in minutes, and the software is updated, in the large cloud providers. If we think we can outdo that with our on-premises system, and we all know most of the on-premises systems get breached, as people like to say, if it hasn't been breached yet, you don't know.
You don't know
that it's been breached, right? So those kinds of things, if we fail to use new technologies because we have outmoded fears about them, then we will deny our patients and we'll deny our future. I think there's many other interesting things that have cropped up, around those challenges, and we do risk something we have to keep an eye on. We do risk, as we deploy digital technology and as we make it more accessible to some, many of us are able to. Give you another example from the pandemic. Many of us are able to work from home. And that's actually made our lives very bearable during the pandemic. And it's actually made us even perhaps more productive, even though we miss out on some conversations. But think about the essential workers, right, who are now, very exposed during this period. They don't have that opportunity. The people who are less well off, that this digital revolution is going up, the tech stock prices are going up like crazy. But these people in the less well off parts of society are actually suffering. Disparities are becoming worse. So we have to look at the whole effect of technology. It's made it a lot better for some, but it's actually making it even harder for others. So we have to take all these factors into account.
Great point.
Yeah.
So in summary, Robert, what's your prognosis? I mean, 5 years from now, do you think we will have made progress, or do you think the inequalities that digitalization can engender sometimes, will that cause unrest?
I think properly managed, I'm still very optimistic. I think if you just look back at how each of us have benefited from having the world's information at our fingertips, and properly managed, I think you can only be optimistic at this time. You just have to keep an eye on these edge conditions, and that's where governments, and I think there are many governments around the world that are thinking about these things carefully. I think they can do this, they can manage it. And if you allow fear to be instilled, if you allow fake news to take over, and if you allow these disparities not to be managed, if you allow people to be locked into lower echelons, then you're asking for trouble. But if you don't, and many governments around the world and many social systems are able to alleviate those issues, then I'm sure we will all move forward.
Shobana, Abel, any final thoughts on the new normal, healthcare and the new normal, before we end this session? Because it appears with our time is up. Shobana?
I don't think I could top what Robert had said. Well said.
Yeah, even I really appreciate what Robert said. And I think that as much as you speak about inclusion, Robert, this could be, digital transformation could actually be a tool where, where the unprotected, where the people that, from the socially backward could have a chance to lead healthier lives. So we have to make sure that we take care of that. But I completely appreciate your point.